Hello, everyone. It's game time. Welcome all to Fab 5, Jump into Action with the Healthy Brain Initiative Road Map. I'm Molly French, coach of Team Public Health at the Alzheimer's Association, joined by Associate Coach John Sheehan, with support from the Centers for Disease Control and Prevention. This webinar is going to help you successfully tip off your agency's efforts to quickly and strategically prepare all your communities for the growing burden of dementia. Let's start with a few housekeeping items. First, all lines have been placed on mute to eliminate background noise. We were also recording today's live cast, so it's available to others. We have about 10 minutes reserved at the end for questions and comments. So use that Q&A feature. If you just kind of move, if you're on your computer, if you kind of mouse over to the side of your screen or up to the top, it should appear. We love audience interaction, so please type in your questions and comments as we go. Don't wait for the last minute. The chat box is useful if you need to reach us here as your webinar administrators. And I'm going to ask you a favor. Before the live cast ends, please just take a minute. I'm going to give you a link to a feedback form. We want to improve our game, and the feedback should just take 1 to 2 minutes is all to complete. And we're very interested in your opinion. Once the recording's available, everyone who registered for today is going to get the slide deck, a link to the recording, as well as the resources that we've featured. In 1991, the Fab Five changed the basketball landscape. The University of Michigan recruited these 5 talented young men to the basketball team. By the end of their freshman year, they're freshmen. Their individual and collective talents had catapulted the Wolverines to the 1992 NCAA Men's Basketball Championship game. They were so reliably fabulous that the coach had these 5 freshmen start this high-stakes game. And then he made the same choice in 1993 for that championship game. Well, the Fab Five had both fame and some controversy, but in 1992, many basketball fans regarded them as a dream team, one that leveraged the strengths of each member to generate synergy. And in our field, leveraging the strengths of individual public health interventions to generate synergy has helped turn the tide when public health has gone head-to-head with challenges like HIV/AIDS, cancer, and more. Similarly, if we're going to make progress on Alzheimer's and other dementias, we're going to have to up our game and use multifaceted approaches. Today, our Healthy Brain Initiative Dream Team of national and state public health experts are going to share their playbooks with you. Going alphabetically, they are Paula Clayton, National Association Chronic Disease Director; Thea Griffin with the New York State Department of Health; Dr. David Hoffman with Maria College and the National Association of Chronic Disease Directors. We have Dr. McGuire, Centers for Disease Control and Prevention. She's the head coach for Alzheimer's Disease and Healthy Aging Program, and on her team is Benjamin Olivari. And again, if you're just joining us, I'm Molly French with the Alzheimer's Association. Over the next segment, our experts are going to give you a fast-paced overview of the Healthy Brain Initiative, its roadmaps, and the 5 areas for public health action. Then it's going to be your turn. We'll use the questions and comments that you're posting throughout this live cast and just post them in the Q&A feature, and we'll pick up as many as we can at the end. And we promise to end on time. When this live cast ends, you'll know why public health is urgently needed to help mitigate the impact of Alzheimer's and other dementias, how public health agencies can apply for funding from CDC to get in the game. And then to help you prepare, we're going to explain the life course approach and opportunities for action at multiple points. You'll also get a sense of some of the best tools and resources that are available, so today you can begin integrating cognitive health, paying attention to dementia and caregiving in your public health efforts. I do want to thank our LiveCast sponsor again, CDC, and especially our co-host, the National Association of Chronic Disease Directors, which has been a long-standing HBI partner. And now, our first All-Star to take it to the hoop, Ms. Taya Griffin. She's the coordinator of NACDD's Alzheimer's Interest Group and a highly valued member of the New York State Department of Health team. Take it, Taya.
Thank you, Molly. Hi to everyone who is on the phone today. Glad you could join us. So what is dementia? As you know, dementia is an umbrella term for a set of symptoms characterized by the loss of cognitive functioning that is severe enough to interfere with daily life. Dementia is not a normal part of aging, but rather a chronic condition that some people develop, usually later in life. Several diseases and conditions cause dementia, and among them, Alzheimer's disease is the most common. Research tells us that many, if not a majority of cases of dementia are mixed. That is, there is more than one cause of a person's dementia. Alzheimer's is an irreversible progressive brain disease that slowly destroys memory and thinking skills and eventually the ability to carry out the simplest of tasks. Next slide. Next slide.
Ready for you. Just keep going. Thanks, Taya.
Okay. I wasn't sure. Achieving meaningful progress against Alzheimer's requires a robust public health response. The expert-guided Road Map series provides state and local public health officials with a flexible menu of options to efficiently and effectively integrate cognitive health into existing initiatives and services. Next slide. This webinar focuses on the state-local roadmap. If you'd like to learn more about the roadmap for Indian country, the Alzheimer's Association's YouTube channel has an hour-long webinar to introduce viewers to this important guidebook for tribal leaders and tribal health and aging professionals. To make it easier to do the actions in the roadmap for Indian country, the Association of State and Territorial Health Officials and the International Association for Indigenous Aging create a Healthy Heart, Healthy Brain set of educational materials with CDC support. And after the webinar, as Molly mentioned, we'll share the slides so you can have the links to these resources. Next slide. Opportunities for intervention. Both of the current roadmaps encourage public health to use a life course approach. And after all, public health has improved outcomes for heart disease, diabetes, and other chronic conditions by taking a life course perspective. The same life course approach will also make a difference in addressing the growing impact of Alzheimer's and dementias on our communities. Changes in the brain associated with Alzheimer's and other dementias take root for many years, even decades, before symptoms appear. And in this graphic, the purple area is the dementia continuum for populations that develop dementia. It starts with healthy cognitive functioning and progresses through cognitive impairment before reaching the dementia stage. The blue outer bands are ways the public health community can intervene along the continuum. And today our presenters will describe some of the many ways that public health can reduce risk of cognitive decline, promote early detection and diagnosis of cognitive impairment and dementia, and ensure the safety of and improve the quality of care for people impacted by dementia in their communities. By using a life course approach, public health has numerous opportunities to alter the trajectory of Alzheimer's and improve brain health. Next slide. Core issues. A comprehensive public health effort to address Alzheimer's and other dementias would be active in each of the roadmap's Fab 5 issue areas. And the issue areas are, as you can see here, collecting and using data, and evidence to inform action on Alzheimer's, and reducing risk for cognitive decline and dementia, advancing early detection and diagnosis of cognitive impairment, supporting caregiving for people living with dementia, and educating and training professionals. Our dream team will present on each of these. And as a reminder to our listeners, please use the Q&A feature in Blue Jeans to ask questions or make comments. Next slide, please. We are so fortunate to have as our first speaker Dr. Lisa McGuire from CDC to speak to us about using data and evidence to inform action. Dr. McGuire.
Very much, Tab. Next slide, please. So we know that there is a need for public health action, and one of the ways that we can demonstrate that need for public health action, or why it's so important, is by looking at some of the data that's available and the stories that we can use that data to tell. So this slide is showing us some of those different data points that can be used to demonstrate the need or the burden or the demand in your geographical area. So one of the things that we know is with the number of people with Alzheimer's estimated to nearly triple by 2050, reaching to 14 million people, it's necessary to monitor the health and the health needs of that growing population. We know that about 15% of adults 45 and older have other chronic health conditions, as well as have reported that their memory has gotten worse in the past year. We also know those people who have subjective cognitive decline or their memory is getting worse in the past year, that 1 in 8, more than 1 in 8 of those individuals reside alone. We also recognize, in a recent CDC report that was released last week, indicates that 1 out of 5 U.S. adults 18 and older is providing regular care or assistance to their family member or friend who has a health condition or a disability. We also know that many of those people who are providing care or assistance also are reporting that their health is worse too. Next slide, please. So the Healthy Brain Initiative roadmap has several different action items that are consistent with 4 of the 10 essential services of public health. So this slide is showing us roadmap actions that fit into 3 of those 4 quadrants that are emphasized in the Healthy Brain Initiative roadmap. So the first of those I'm going to highlight today is M3. And M3 is talking about using data that is available through surveillance or other strategies or other systems to use that to inform public health programs and practice related to cognitive health, cognitive impairment, and caregiving. E2 is talking about taking the best available evidence that's available related to brain health and cognitive decline risk factors and incorporating that into existing health communication messages that are really designed to promote general health or management of chronic health conditions of people across the lifespan. Then the W, or the workforce category, W3 highlighted here, is talking about educating health professionals, specifically public health professionals, about the best available evidence related to dementia and the detection of dementia, as well as caregiving that can be used to support public health and provide information related to supporting public health action. Next slide. One example that we have of a jurisdiction who's taken data and been able to transform that data and use it as a case for action is the Summit County Public Health Department. They partnered with the Alzheimer's Association Greater East Ohio Area Chapter. And what they did is they worked together to use local data to increase public awareness of cognitive health concerns and enable community leaders to begin planning a stronger community-wide response. So this local level data analysis was performed for the entire county in 20 sub-county geographical regions on several factors associated to the risk of Alzheimer's disease and other dementias, as well as mortality rates within that county from 2000 to 2016. And in 2018, Summit County used the results from these analysis of their county data to publish Alzheimer's disease in Summit County Statistics Brief, which contrasted local level data with national and Ohio-specific facts to help the reader understand how dementia can differentially and did differentially impact their county. The next slide, I'm going to highlight for you some of the data that CDC has available. Through CDC's Behavioral Risk Factor Surveillance System, there are two modules that I'm going to highlight today. The first is on subjective cognitive decline. And so what this asks is it asks the person completing the survey if their memory has gotten worse over the past year. It also asks if they have difficulties associated with their daily living that is due to those memory concerns. We also inquire if they've discussed with their health care provider any of their concerns about their memory. And this is asked of people 45 years old and older. And as you can see by the map graphic, that between 2015 and 2018, all 50 states, D.C. and Puerto Rico, participated in the Behavioral Risk Factor Surveillance System's Cognitive Decline module. Next slide. So I'm going to highlight for you very quickly some of the materials that we have produced at CDC. So the first are our infographics. So for subjective cognitive decline, we have on the left-hand side, we have the national estimates of cognitive decline, and then we have translated that into Spanish. Next slide. We also have developed those infographics by race and ethnicity. So here you're looking at the Hispanic adults, which is also translated into Spanish, African American adults, and American Indian and Alaska Native adults. And the one I did not include on my slide is we also have state-specific infographics for all of those 50 states, D.C. and Puerto Rico, that participated in the BRFSS Cognitive Decline module. Next slide, please. This highlights the caregiving module that is also available on BRFSS. So this asks adults 18 years old and older if they are providing care, regular care or assistance to a family member or friend who has a health problem or a disability. And if they say yes, then we classify them as a caregiver. So those people who are classified as a caregiver are asked several other questions. They're asked what kinds of problems they face in their caregiving situation, what their greatest needs are as a caregiver, and if they're not currently a caregiver, we ask if they anticipate being one in the next 2 years. This module has been administered to 44 states, D.C. and Puerto Rico, as well since 2015. And we released a report last week that we'd be very glad to share with you in the Morbidity Mortality Weekly Review, so CDC's MMWR, summarizing the health status of caregivers by state. So we have, next slide please, a very similar portfolio of infographics developed for caregiving. So the first slide I'm showing here is the national infographic that was also translated into Spanish. Next slide, please. We have them by race and ethnicity, as well as for each of the 44 states, D.C. and Puerto Rico, that participated. Next slide, please. CDC's website, cdc.gov/aging, under the Data and Statistics section, we have an Alzheimer's disease and healthy aging data portal. This healthy aging data portal allows you to produce state fact sheets. It allows you to download data and analyze it or use some pre-existing analysis that have occurred. The next slide shows an example for the District of Columbia of what some of those analyses look like. So please check that out. The next slide are the tips. And I'm going to share with you a couple tips before passing the ball to my colleague, Benjamin Olivari. So the first thing I want to say is that numbers always have an important story to tell. They really do rely on us to give them a clear and convincing voice and to really share why and how they matter and how they can be used to show a need for potential change or to demonstrate the change and impact that has been made beyond them. And then I'll close with the basketball great Bill Russell, who said the only important statistic is the final score. So data does matter, and I'm going to pass the ball to Benjamin Olivari. Ben?
Thank you, Lisa. Next slide, please. So many people ask, if Alzheimer's is irreversible and there aren't reliable treatments for Alzheimer's, what can public health do to help? Well, fortunately, in recent years, there's been a growing scientific evidence base for ways in which people can reduce their risk for cognitive decline and possibly Alzheimer's and other dementias, and that includes promoting healthy behaviors. Both the National Academies on Science and the Alzheimer's Association independently concluded that regular physical exercise, smoking cessation, and the management of certain cardiovascular risk factors such as diabetes, midlife hypertension, and midlife obesity are steps that adults can take to lower the risk for cognitive decline. Additionally, a recent NIH-funded study showed that aggressive blood pressure control can significantly reduce risk for mild cognitive impairment and may lead to decreased risk for developing dementia. So one thing to keep in mind is that certain groups are at increased risk for cognitive decline. So for example, among African Americans, Hispanics, and American Indians, related risk factors like high blood pressure, diabetes, and these other chronic conditions, which are already more prevalent among those populations, may make them also at increased risk for cognitive decline. Moreover, women are also at increased risk for Alzheimer's. So it's estimated that about 2/3 of older Americans with Alzheimer's are women, and that women who reach the age of 65 are have about a 1 in 5 chance of developing Alzheimer's, compared with only a 1 in 9 chance for men. Next slide, please. So here are some of the actions that we've outlined from the roadmap that directly relate to reducing risk for dementia and cognitive decline. So the first is an education component, and this one is to educate the public about brain health and cognitive aging, especially those changes that can be discussed with a health professional. And then hopefully that can lead to an earlier detection and potentially a diagnosis of a mild cognitive impairment or dementia. Secondly, public health professionals and others can work to integrate the best available evidence about brain health. So talking about those chronic diseases that and other lifestyle factors that may increase risk, and integrating those into existing health communications that promote health and chronic condition management for people across the lifespan. We can also engage public and private partners in ongoing planning efforts. So this can help to establish services and policies that can promote supportive communities and workplaces for people with dementia or others who are experiencing memory issues, as well as their caregivers. And finally, we can use data through those surveillance strategies to inform the public and also lead to more informed policy making in response to the cognitive health as well as caregiving issues. Next slide, please. Next slide. Thank you. So New Jersey's Office of Minority and Multicultural Health, along with the Alzheimer's Association chapter and Rutgers, came up with this really cool idea as to how to integrate risk reduction messages into things that people at risk might be interested in. So what they did is they combined educational information on brain health and Alzheimer's, including ways to reduce risk, alongside a classic car show, which older men might be particularly interested in. At that show, they also presented attendees with opportunities to participate in aging research at Rutgers, so they took advantage of the presence of people who might be interested in that kinds of research. Next slide, please. So there are a couple really good resources that might help those who are trying to take the next steps to use risk reduction in their messaging campaigns about cognitive decline. So the Alzheimer's Association developed these really nice, easy to read, easy to understand messages related to different chronic diseases and injury prevention methods. So, for example, they talk about how you can be safe with by wearing a seatbelt, and how that might also protect your brain. But then there's other sections, such as how quitting smoking is better for both your brain and your body, and that if you quit smoking now, you might reduce your risk for dementia. So it could help both with motivating those that are already smoking to quit smoking, so that they can reap some of the benefits related to lungs and other chronic diseases, but also might motivate them to protect their brain. Next slide, please. So another great resource that the Alzheimer's Association has come up with, and I encourage you to go to the link below. It relates to protecting the heart and the brain. So it talks about how managing hypertension can reduce the risk of cognitive decline. And for those interested in state data, there's specific data by state on cognitive decline and hypertension and the connection between the two. And then there's also other resources related to blood pressure. For example, there's a campaign by NIH related to the connection between blood pressure and cognitive decline, and that's in that resource as well. Next slide, please. So it's important to remember that although there isn't a treatment or a cure, there are actually ways to reduce risk for cognitive decline and potentially dementia. And those opportunities focus on promoting healthy lifestyles and managing chronic diseases. So we can talk about preventing tobacco use, controlling blood pressure, and managing cardiovascular disease, and preventing and managing diabetes, preventing and controlling obesity, and limiting injuries, including head injuries. And I'm going to turn it over now to David, who will go over early detection.
Thanks, Ben, and thanks for the opportunity to share some thoughts on early detection this afternoon. Next slide, please. So I'm going to talk about early detection in the context of some experience that we had in New York State. So just as background, New York State provides evidence-based health and support services for people with dementia and their caregivers across the state. There are about 400,000 New Yorkers currently who have a diagnosis of Alzheimer's disease, and we project that by 2025 that will increase by another 60,000 people. In 2018, about 1 million unpaid caregivers for people with Alzheimer's and related dementias provided 1.2 billion hours of unpaid care with an estimated value of $15 billion. Clearly, the volume of the issue here is important for us to take some action. Providing care to individuals with Alzheimer's has resulted in an estimated $771 million in higher healthcare costs for New York caregivers. Next slide, please. So, the value of early detection and diagnosis is important for all of us to consider from a public health perspective, from a healthcare perspective, and from an individual perspective. Early detection and diagnosis better equips families to plan in advance, to make informed decisions when people retain autonomy, to seek higher quality care, to understand disease implications, not just for their Alzheimer's, but as we've heard this afternoon, having a better ability to manage other chronic conditions that may be present, arranging social supports and increasing access to services. There are delays in costly nursing home placement and avoidable hospitalizations, both of which can be harmful both to the patient and the caregiver. Participating in clinical trials gives people an opportunity to find effective treatments and that's not always easily accessible. Next slide, please. So in New York, the efforts that have taken place, all based on the Healthy Brain Initiative Roadmap goals and action agenda, include the implementation of a $25 million annual strategy. It's a statewide initiative, first of its kind in the nation, and it involves specialty training to medical, healthcare, and public health professionals, and importantly, consumer awareness, education, and outreach. Next slide, please. The Caregiver Support Initiative, which is the name of this particular investment here, includes Centers of Excellence for Alzheimer's disease, which are not unlike the description of Centers of Excellence in the BOLD Act, a regional caregiver support initiative, including substantial support for contractors across the state of New York, both in high-density urban areas and rural areas in the North Country. Caregiver support targeted to specific underserved populations that have been identified by some of those data sources we heard Dr. McGuire talk about. The Alzheimer's Disease Community Assistance Program, which predated the initiative on a much smaller scale and is a partnership with the Alzheimer's Association on a statewide basis, and importantly, from a public health perspective, an external project evaluation on an annual basis. Next slide, please. So in terms of implementing the Healthy Brain Initiative Roadmap in New York, what can we do for early detection? Well, in terms of educating and empowering, addressing community groups and caregivers through consultation services, support groups, educational sessions, respite hours, helpline calls, and providing research and practice-based webcast began with the initiative and continues through this date. Developing policies and mobilizing partnerships through the development of the New York State Coordinating Council for Service related to Alzheimer's disease and related dementias, which includes all state agencies that have an interest in this population or in their caregivers. Partnering with the Alzheimer's Workplace Alliance, a national project of the Alzheimer's Association that provides a ready supply of potential partners in employers who have an interest in supporting their workforce. And the creation of the National Association of Chronic Disease Directors Alzheimer's Interest Group. We felt early on with this investment in New York that we had a responsibility to share what we were learning with colleagues in other states. Next slide, please. Assuring a competent workforce. One of the first successes we saw in the initiative in New York was the Centers of Excellence, and you see CED is the acronym for the Centers of Excellence, provided a tremendous amount of training to physicians, healthcare professionals, and medical and health profession students. But there were also 186 new positions, FTEs, that were created in and through these centers of excellence. So that's a fairly substantial addition to the healthcare workforce that had a degree of competence in early detection, which we identified as being important in the beginning of the project. And as I mentioned, there's an external partnership with the University at Albany School of Public Health for a statewide evaluation of the Alzheimer's Disease Caregiver Support Initiative. And there's a program manager in the program at the health department that provides oversight to each group of contractors for the effective delivery of services and supports. Next slide, please. I'd like to turn the floor over to Paula Clayton. Thanks, Paula.
Thank you, David, and all of you for the opportunity to talk about a project that NACDD has been working on with CDC, Dr. McGuire and her colleagues, as well as to share a state story on caregiving. The need for public health action is well documented with these data that you'll recognize from the roadmap, and they illustrate the significant demand for caregiving due to Alzheimer's and dementia. The time demands that caregiving imposes on adults while raising young families, and the challenges posed to working caregivers while trying to meet the needs of their older adult in need of care. So as you can see from the statistics that are cited here, nearly half of the caregivers who care for an older adult do so for someone with Alzheimer's or other dementia, and only about half of employers have policies that support caregivers in ways such as flexible hours, telecommuting, and family leave. So let's go to the next slide. And here we'll see the roadmap actions that are especially pertinent to this topic presented here. First of all, to educate and to help anticipate what is ahead for both the caregiver and the person with dementia, strengthening knowledge and use of care planning, and promoting the use of effective interventions and best practices to protect brain health, as we've heard about already through from Ben, and then addressing the cognitive impairment and help meet the needs of caregivers for people with dementia, which is really an important aspect of the work that we have been doing. In the next slide, I wanted to share just briefly a case study for caregiving that just follows along with these recommendations and the roadmap. This comes from New Mexico. It's actually highlighted in the roadmap document and illustrates these three roadmap actions as a unique and practical way for a state health agency to team up with other state departments, particularly the Department on Aging, to impact the health and the care of the caregiver as well as the person in need of care. In New Mexico, the Department of Aging offers a free Savvy Caregiver course designed to help caregivers learn how to handle the challenges of caring for a family member with Alzheimer's and other dementias. At the same time, the state health agency supports a chronic disease self-management course. So the two state agencies teamed up to co-market their two courses as a package, as older adults living with dementia are more likely than their peers to have multiple chronic conditions, including hypertension, heart disease, diabetes, and such, and caregivers are more likely to be managing their own chronic diseases, but neglecting their own care. So the chronic disease self-management course in New Mexico encouraged the participants to enroll in Savvy if they were a caregiver, and the Savvy course participants were encouraged to enroll in the chronic disease self-management course upon completion of the aging course. So you're on the right slide here with resources and jump into action. I mentioned earlier that NACDD teamed up with the CDC Division of Aging to examine the subjective cognitive decline in the population. So we use the data from the behavioral risk factor surveillance system that Lisa McGuire was talking about, the two modules within the BRFS, looking at data from 2015 to 2017. And we studied two age groups, adults age 45 to 64 and the adults 65 years of older. And we also looked at those demographics by sex, race, Hispanic ethnicity, chronic disease status, and other demographic characteristics. So the first brief, which is pictured on the left, provides an overview of subjective cognitive decline from a population perspective. And it profiles and maps things like the percentage of adults with cognitive decline, the percent who live alone, the percent who have discussed their memory loss or confusion with a healthcare professional, and it's presented by age groups and other demographic characteristics. The second brief, which is the third one from the left, is focused specifically on the caregiver, their characteristics, the percent of adults in the two age categories who are providing care to family and friends, the health status of the caregivers, and perhaps more importantly, from a future public health planning perspective, we looked at the percent of adults who expect to be caregivers in the future. As Dr. McGuire mentioned earlier, that's getting to be a big issue for public health. The series goes on to examine coronary heart disease, myocardial infarction, and stroke, including the prevalence of SCD among those who have been diagnosed with coronary heart disease, myocardial infarction, or stroke. And then the fourth brief looks at the relationship of SCD and older adults living with chronic disease. All of these briefs can be found at the web address. There's not time in 6 minutes to give you the really, to highlight the data that we found, but you can study these on your own. All of them are found at the web address that are on the slide. They're filled with maps and tables that help to put into perspective, I think, the health impact of cognitive decline on caregivers and those who are experiencing cognitive decline. So each brief also contains a set of recommended actions for public health in addressing this growing issue as we collectively work to respond to issues prioritized in the roadmap. And full disclosure, the fourth brief is not actually on the website yet, but it will be there very soon. So let's move on to the next slide. And in summary, the tips here is that caregiving really is a team sport. As adults live longer with diseases of the heart and circulatory vessels being prevalent in this growing population of older adults, caregiving is becoming an important public health issue that affects the quality of life for millions of individuals. Caregivers frequently fail to take care of their own health, and they frequently live with comorbid chronic diseases of their own while they're trying to care for people with cognitive decline. The case study from New Mexico is a great example of how a state public health department can leverage its resources by engaging another state agency to promote chronic disease self-management of the caregiver as they manage the needs of the adults they're providing care to. The initiative in New Mexico speaks to the roadmap actions E5 and P1 in particular that were on an earlier slide. It was a low-cost initiative to sustain and address some of the challenges that are related to dementia caregiving. And because the chronic disease programs in states are already promoting and coordinating chronic disease self-management programs, which generally evolved from either diabetes or cardiovascular or arthritis programs, and are now using the evidence-based chronic disease self-management program, it's also the type of approach that other states could readily adapt and build from using existing resources. So with that, I will stop, enjoy the briefs, and I will pass the ball over to Molly French.
Thank you so much, Paula. And everyone, we have just a couple minutes to tell you about workforce development. Then we're going to switch to Q&A. So please do use that Q&A function on the side of your screen, or you may have to mouse up, have it drop down, but we are very interested in your questions, your comments. To realize our hoop dreams, we got to have a team that's talented. And there are opportunities for public health, healthcare, and other professionals to brush up their game. As more and more people are going to be living with dementia, there's a need for workforces across the whole community, but particularly prioritizing public health, healthcare, direct care workforces. All of these workforces are going to need to grow in numbers, but then also have the fundamentals they need to serve people living with cognitive impairment and their caregivers, be able to serve them effectively. Many of the current professionals have not had any formal training, in part just because relatively few states require dementia-related competencies in order to get keep and maintain clinical credentials. Also, just a small group of medical students tend to choose geriatric electives during training. The Public Health Roadmap identifies a number of actions, and we've selected 3 here to feature today. So one is for public health. If in your emergency preparedness and response plans, make sure that there are provisions in there so that the relevant workforces are ready to meet the special challenges of people living with Alzheimer's and other dementias. Many of them are living in the community, and emergencies really heightened some of the vulnerability, particularly faced by people living with dementia. In addition, doctors, nurses, dentists, home health workers, social workers, all need to know where to go for the latest science on brain health and dementia, and then be able to apply it to their practice. And a third roadmap action for public health is because the vast majority of people living with Alzheimer's have multiple, one or more other chronic conditions, healthcare providers need to know how to best manage comorbidities as well as address the safety and the behavioral health needs of people living with dementia. So one example that we've just fantastic, and it's something many other public health agencies can replicate. The Colorado Department of Public Health and Environment took on this challenge of preparing first responders to address the unique communications, behavioral, and physical needs of people living with dementia. They partnered with the Alzheimer's Association Colorado chapter and then promoted to all of Colorado's regional emergency trauma and advisory councils, said here's a great opportunity you should be pursuing. Have come in, let the Alzheimer's Association come in and conduct a free training for your members so that your first responders know how to work with people living with Alzheimer's, other dementias, and what can also be some common situations that can be tricky to manage, whether the person with Alzheimer's is wandering, perhaps they've gotten lost driving, or are perceived as shoplifting. There are a number of wonderful resources to get started in terms of educating your workforce. One is from the American College of Preventive Medicine. They have a brain health course that is sign up for free continuing medical education units. The URL is there. And another resource is from a partnership that we've done with CDC, and it's a curriculum, free flexible curriculum that was developed by Emory Centers for Training and Technical Assistance for public health professionals and related disciplines. So as you look, these are resources that can be used today to readily start addressing some of those growing workforce needs in your communities. And I do want you to remember that the people living with dementia and cognitive impairment, a lot of them are not necessarily in nursing homes, but they're in homes and apartments throughout your community. And their ability to stay engaged in community life, stay safe, and keep their comorbidities in check depends in part on healthcare providers, first responders, public health, direct care professionals, and others having the know-how to serve them effectively. And as you go out to develop your workforce and help develop competencies, have a conversation with your local Alzheimer's Association chapter to explore how they might be able to help. And now we are just a minute away from the question and comments. Do want to really encourage everybody, spend some time going to these three websites for more information and action and read these resources. They include alz.org/public health. That's our Alzheimer's Association Public Health website. NACDD has those wonderful briefs that Paula mentioned at chronicdisease.org. And Dr. McGuire mentioned a whole host of range of different materials and resources, in particular data. Really spend some time, dedicate some time on your calendar to go to cdc.gov/aging. And now I'm going to pause for a non-commercial break and turn it back to Dr. McGuire to tell you about some new funding opportunities.
Thank you, Molly. At CDC, we're real excited to talk about two of our new initiatives that have been supported through the Building Our Largest Dementia Infrastructure. So currently on grants.gov, both of these funding opportunities are listed in the forecast phase. We are very hopeful and optimistic that they should be released and published in the next couple weeks. So I'm pleased today to tell you about two of those. So the first is Public Health Centers of Excellence, and you can see the RFA number listed there in the mailbox if you have any questions about that. And what that funding opportunity does is that will support up to 3 public health centers of excellence focusing on caregiving for persons with dementia, reduction of risk of dementia, and early assessment and diagnosis. The second opportunity is supporting public health programs to address Alzheimer's disease and related dementias. That's the 2004 opportunity. And this will support public health within states, political subdivisions of states, tribes, or tribal organizations to really build that public health infrastructure to support the families and the people who have Alzheimer's disease and related dementias, as well as their caregivers. And this is going to be building upon the Healthy Brain Initiative Road Map series. And you can see the mailbox there listed. So once these opportunities are published, we will have it updated on our website, cdc.gov/aging, and we will also be sending out our newsletter that will be highlighting those opportunities. So if you have any questions, I will answer what I am allowed to answer at this point until the funding opportunities are released, and I'll throw the ball back over to my colleague, Molly French.
Thank you so much, Dr. McGuire, and for giving us that special briefing. My colleague, Associate Coach John Sheehan, will be helping us with Q&A.
Thank you, Molly, and thank you to all of our speakers today. Wonderful information. I know a lot of these things, but every time that I sit in, I always pick up a new tidbit here and there. So I hope this has been information and educational for everyone on the phone. The first question that came in that a couple of people asked, will the slides be available? Yes, later this week, maybe into early next week, we'll send out a copy of the slide deck, associated materials that were mentioned today, as well as a link to the recording for all registrants, even if you weren't able to participate today. But the next question is actually for Dr. McGuire. Dr. McGuire, could you tell us a little bit about what the life course approach means as far as Alzheimer's and dementia are concerned?
Yes, thank you very much, John. So Taya, in her introduction, showed we call it, I guess, the wedge, which shows the life course perspective. And so the way that we're conceptualizing it from a public health perspective is we are looking at a person and we are trying to, on the left-hand side of that, so the younger years of a person's life, we're really using that as an opportunity for risk reduction. So really supporting and encouraging disease prevention, health promotion, chronic disease management, and self-management, and really making sure that people are engaging in that healthy lifestyle that the evidence keeps emerging to show that is supporting brain health. Then as a person's life goes they get a little bit older and they may start to show some declines. That's the opportunity for public health to intervene there. It's through the early assessment and diagnosis, and also really trying to, once again, hone and fine-tune those healthy lifestyle behaviors. And then later on in the life course, really making sure that we have quality care, and we also are providing support for those who are serving in a caregiving capacity. So in other words, we're taking a lifespan approach as opposed to focusing on the risk reduction and the quality care in addition to just focusing on the disease process.
Thank you. Thank you for that answer, Dr. McGuire. I want to switch now to a question for Dr. Hoffman. Dr. Hoffman, could you tell us kind of with the program that you talked about today, what is being done to reach underserved communities?
Great question. Actually, there are a couple of specific targeted initiatives for underserved communities. One is focused on racial and ethnic communities that are traditionally underserved. There's a separate set of contractors who were awarded funds to focus on those groups specifically with some innovative strategies. But secondly, both the Centers of Excellence that were funded by the state of New York and the Caregiver Support Initiatives have in their work plans targeting people who have traditionally been underserved, and that includes folks who are geographically underserved as well as people who are underserved due to some other status that they belong to.
Wonderful. Excellent. Thank you so much, Dr. Hoffman. Dr. McGuire, a few more questions came in. Lots of excitement around the BOLD Infrastructure for Alzheimer's funding. And I know that the notice of funding opportunity is not yet published. Wondering if you're able to answer either of these questions. The first one, when do you expect those notices to be published? And the second one, is there an anticipated, for every application that comes in, for every state, locality, or tribe that applies, do you anticipate having enough funding to award each of those applications?
Okay, so the first question is, when do we anticipate that the funding opportunities will be published? The original projection was Friday of this week. We are still going through our internal departmental clearance, so we're hoping that they will be published in the next week to 2 weeks. When they are published, there will be an interested applicant call, and then the applicants will have 60 days to submit an application. The other question, John, was it asking, will there be enough funding for each applicant?
Yeah, so kind of with the appropriations that are attached to the BOLD funding, do you anticipate having enough funding to award each application that comes in? If you're able to answer that at this point.
Yeah, at this point I cannot answer that because we can't answer that. We also don't know how many applications we will receive either, so I can't answer that until we have a better indication.
Excellent, excellent. Well, thank you all for your questions today. I know we're just at top of the hour, so I will kick it back to, or pass it back to Molly French.
Thank you, John. Thank you so much to our Fab 5 national and state public health experts for presenting to us, and a warm thank you to everyone who's been on the webinar today. Please do help us improve our game. Just take about 2 minutes to use this URL and and give us some quick feedback on the before you restart your day. To recap, when you're back back to your regular day, remember that there is funding that will soon be available to help you mount a public health response to the growing impact of Alzheimer's and other dementias on your community. And as Dr. McGuire just explained and highlighted again, a life course approach really means putting into play multiple public health strategies, our Fab 5 of risk reduction, early detection, attention to caregiving, data, and workforce. And then lastly, you can jumpstart your Fab 5 by using available tools. And I'm going to turn for a quick final word from today's co-host, Ms. Griffin.
Thanks. I think just to reiterate, here, learn more and get started. These are the 3 websites that can give you information on what will support you in putting some of the Healthy Brain Initiative items together and the action steps. So on behalf of the NACDD Alzheimer's Interest Group, I want to thank our presenters and everyone who were able to join us today for this webinar. Thank you again.
Right, and thank you, everyone. Thank you so much, Ms. Griffin. And we will be sending out the slides, a recording, and links to other resources towards the end of this week or early next week. Thank you again for your time. Goodbye.